Hi, Dr. Yass here. It is a new year and another opportunity for people to be able to find the answer to why, after all the treatments they've received, that they are still having chronic pain. I think this is probably the biggest issue, medical issue facing the globe at this point. And 40 years into the process of having chronic pain as a medical issue, it has not gotten one iota better. In fact, there hasn't been a single time that the numbers of people suffering with chronic pain has reduced. It just keeps going up. The severity of the pain continues to go up. The length of time the person is suffering has gone up. So there has to be a question asked. After all this time, 40 years into this process, why does chronic pain still exist? Now, the problem for the average person is that they don't realize that there is a chronic global epidemic. They just see their own pain and their own suffering and are trying to figure out, why am I suffering with chronic pain? And all I hear about are these incredible stories of how people have had these surgeries and magically they're doing everything that they were told they would be able to. And it turns out that most of those stories are simply fake. They're just not true. They're cultural premonition. They're culturally designed stories, but when you look at it in reality, it's not even close to the majority. It's a lesser amount. It's a minority of people ever actually feel some benefit from the joint replacements and the back surgeries. So to put it into context for those of you who are suffering with chronic pain, so you understand you're not alone and that there's actually something systemic, there are 140 million Americans, roughly 1 billion people worldwide. So 1 out of every 3 Americans is suffering with chronic pain, and 1 out of every 7 people globally are suffering with chronic pain. So you got to start with we'll start with the beginning as to when chronic pain began, and then we'll get to the reason why chronic pain exists. And hopefully with this understanding, you'll see that your search situation actually fits quite clearly into this circumstance. So throughout the history of mankind, chronic pain never existed. Get this through your head. Chronic pain was never an issue in the history of mankind. Go to the Romans, the Greeks, go to any period of time in history, American history, chronic pain was never an issue. Chronic pain began in the mid to late 1980s. And prior to that, if we looked at who was suffering with some sense of longer-term pain, you would see that primarily it was the retired person who was suffering. There was no systemic chronic pain amongst people from 20 to 65. There was nothing like that. Prior to the mid to late 1980s, the only people really suffering with chronic pain was the retired person. And what was known about what happened to the retired person? Prior to automation, the mid to late 1980s, most people did manual labor. And even their recreational activities were manual, multi-directional. So you constantly used your muscles. And as long as the activity level of what you were doing didn't really change dramatically, you sustained an equivalent amount of force of your muscles trying to perform those activities. And as long as they were about the same, there was no straining or eliciting of pain from muscular deficits. So the reason that the older retired person, well, what happened when you retired? That famous story of now you sit on the porch with the rocking chair and you just rock and you don't do anything. Well, what happened to that person? They stopped doing manual multi-directional activity, so their muscles became weaker. And when they suddenly decided they wanted to take a walk or do some sort of planting, gardening, they would strain and elicit pain. And at that time, they called it rheumatism. This idea that somehow it was an autoimmune thing, it was a joint-related thing. It was not. It was muscle. So what happens? What changed from 1970 something to 1980 something? It was the advent of automation, this use of computers, telephones, just technology to do most of what people, or many of the jobs people were doing in recreational activities, now became obsolete manually. It was all being done through a computer or phone or some form of technology. So the most obvious classic one was there was a bank teller when you wanted to get money in the 1970s. Well, by the late 1980s, there was simply ATMs, right? The ATM developed. So now you didn't have someone physically doing this. There was just an ATM, a computer, and maybe there was some person who sat on their butt all day and just was checking through a computer whether the ATMs were working properly. So you went from manual labor to now sitting on your butt. What is by far, since the advent of the internet in the 1990s, what is the largest job occupation in the world? IT, information technology, right? So these are people who sit for 10 hours, 12 hours a day on the computer doing code, or, it's not just information technology. It's social media. It's having websites to sell your products or your goods or services. Everything went computerized. I can assure you that if we went to the classic farm during the mid 70s back, if there was sprinkling that need to be done for the plants or the vegetables or any of that kind of stuff, there was a guy who had to be on a tractor who had to run the area, the acreage, and see if there were any type of holes in the sprinklers, breaks in the sprinklers, or the sprinklers themselves, and then they'd have to manually fix it. Well, once the computer comes, you could put sensors along that, and some guy just has to sit, or a woman has to sit on their butt, look at a computer, and that will tell them whether there are any breaks in the sprinkler system. So what basically happens is you go from a population which is 99% doing jobs and recreational activities that are manual, multi-directional, to a population that even down to the 20-year-old. In fact, the emphasis goes to 20 and 30-year-olds because they're the ones who understand technology, to where they're now sitting 10 to 12 hours. They have, in effect, become the 90-year-old of the 70s. And so now 20, 30, 40-year-olds are now having pain. They're now susceptible to straining their muscles, just like those 90-year-olds of the 70s. So what you see is this massive, massive influx of people into the medical system, not to be treated for colds or other types of systemic issues, but now to be treated for pain. Okay? So that's how we get this massive meteoric rise in the number of people seeking care from pain. It is the mid to late 1980s, and it is automation. That is where you see this rise and the beginning of the chronic pain epidemic. But at this point, it's still acute pain, right? These people are now just having pain beginning. So what happens? Well, if this was the 1960s or 70s and you'd go to your doctor, that doctor would ask you a bunch of questions. He'd physically check you. He'd be looking for symptoms. Oh, but what comes along with that automation in the mid to late 1980s? The MRI, magnetic resonance. What is it? Magnetic resonance. I forgot what the other word. Imaging. Magnetic resonance imaging. So what has changed now is that we go from this idea of symptoms, which are the direct relationship to the cause that's creating it. The tissue in distress, when it goes into distress, elicits a very specific symptom, whether it's a bone, a muscle, or nerve. Each one creates a very specific symptom. So interpreting symptoms help you to understand what tissue is creating it. We now begin this process of fully ignoring symptoms. Now, here's something I need you all to understand. The MRI was not created, the technology was not created to identify the cause of pain. Go back, do the research, and you will see that the MRI was designed to find tumors in the brain. Okay? The MRI, that technology was designed to find tumors in the brain, not to find the cause of pain. Well, think about this. These machines cost $1 million per machine. And how many people are walking around with symptoms that represent they may have a tumor in their brain? So you don't have the demand you need to warrant the cost of the machine. And somewhere, somehow, I would have to try to find people who could research this and really find out what the exact mechanism was. The MRI gets a secondary capacity to say that it can find the cause of pain because we have this massive influx of new people, and wherever they're having pain, I can make the MRI take a picture and it will show a structural abnormality like a herniated disc, arthritis, a meniscal tear, a labral tear, right? A rotator cuff tear. So what you begin to see is that where there is a complete ignoring of symptoms, the MRI is able to present a structural abnormality in the area where the symptom is being experienced and simply asserts that since the structural abnormality is found near or very close to where the symptom is occurring, it is the cause of the symptom. Now, for anybody that doesn't understand logic, that is actually what is known as correlative theory, which is also named junk science. It is the lowest form of attempt to show logic or that something is fact. It is the equivalent of saying, I want everyone to wrap their heads around this because this is the basis by which the global medical system identifies the cause of your pain. Correlative theory saying that just because a structural abnormality is found at the time of your pain for the first time means it's the cause is the equivalent of saying, if I open my front door when the sun rises, I can say opening the front door causes the sun to rise. I can say opening my front door causes the sun to rise because every time I open my front door, you see the sun rise. So you come to me for 6 months to my front door, and every day I open it and you see that sun rise, you start to say, my God, this guy's got the power of the world. He can actually cause the sun to rise. Look at that power. Well, clearly that's lunacy. It's correlative. They happen to be happening at the same time, but because they happen at the same time is in no way an indication of proof that one is causing the other. Just as the identification of a herniated disc at the time of your pain means back pain means it's the cause of your back pain. That is lunacy. Lunacy. It is correlative theory. It is baseless science. Now, to take it one step further, if you want to say that the MRI is accurate and that, in fact, it finds the cause of pain, then we have to say that it's presenting a hypothesis. The hypothesis is that herniated discs cause pain. And I'm saying that's true because, or the science and the medical cabal is saying it because I can find that herniated disc at the time of your pain. Well, science says that for every hypothesis, there must be a null hypothesis. And that must be true. For the hypothesis to be true, the null hypothesis must be true. So, if you're going to say that herniated discs cause pain, what would the null hypothesis be? The null hypothesis would be, of those people who do not have pain, they should not have herniated discs. You see how this makes sense? If herniated discs cause pain, then people without pain can't have herniated discs because you just said it causes pain. 1994. The very first study ever done on anybody who does not have lower back pain shows of the people who do not have lower back pain, 70% are found to have bulging or herniated discs. 1994, it's 2024, 30 years later. So in 1994, the evidence becomes absolutely clear from a scientific basis that the MRI is in fact not finding the cause of pain. And yet the process just continues. So if you're willing to begin to understand that concept, that in fact what it's just finding are independent variables, it's the equivalent of me saying that you have blonde hair and I do an MRI and find a herniated disc at the time you have blonde hair, I could say having blonde hair is caused by having a herniated disc, because the herniated disc was found at the time you have the blonde hair. Just like the herniated disc was found at the time of the pain, therefore it's the cause of the pain. It is the same complete baseless logic. And we are 40 years into the use of the MRI. It is still the gold standard. It is still the mechanism that is used globally. And look at the results. 130, 140 million Americans, 1 billion people worldwide suffering from chronic pain. So you can see that there seems to be something wrong with the use of the MRI. And what I would suggest is that there's one other piece of the puzzle, and this is the piece of the puzzle that I recognized literally as a student in my last semester, where I'm going to be a student treating people. I believe God asked me to ask this question, and it transformed my life 30 years ago. So by 1993, the MRI had been used and it's been standard. And what we see is this mass level of chronic pain. So these people are being told the cause of their pain is structural. It's being treated for structure. But because it's not the structure, those are independent variables. And they're actually having muscular causes, which are not being addressed because they don't show up on MRIs. These people are suffering with chronic pain, and it's becoming widespread now. So at 1993, when I'm graduating, this is about the time it's still percolating, and you're starting to move into the opioid epidemic, which was the byproduct of the chronic pain epidemic. Why did you have an opioid epidemic? Well, what is the purpose of opioids? To mask symptoms. Well, if you identified the cause of the symptom, the tissue in distress, and resolved the stress of that tissue in its acute phase, chronic pain should never exist. That's the way. Let's be clear about this also. For you to understand this, pain was never designed to be chronic. That is part of the body's emergency feedback system, and it is designed to immediately make you aware when a tissue goes into distress at its inception. Right away, it goes into distress, you get pain. So the purpose is that you can immediately recognize the tissues in distress, go get the appropriate intervention, resolve the distress of it, thereby ending pain in its acute stage. So what's going on with chronic pain? Why chronic pain? Because you're not treating the right tissue. And so you're treating a tissue that had nothing to do with the tissue eliciting your pain. So what do you think's happening? That tissue continues to elicit the emergency distress signal of pain. But it goes on and on and on and on because it's muscular. And you continue to have to live your life. You're continuing to try to do activities. So you continue to strain your muscles and elicit pain. So that's what's going on. That's why you want to try to understand symptoms. So what happened with me? 1993, I'm in my last affiliation. And now I'm going to treat people for the first time. And as I said, I think God asked me to ask a simple question. And I don't think anybody else in the medical system asks this question anymore. Could you point to where your pain is? I would say to the person standing in front of me. First question, come to me. I'm going to ask a question. Can you point to where your pain is? And shockingly, where they point to is not where the pain should be if the MRI identified structural abnormality like a herniated disc, arthritis, stenosis, a pinched nerve, any of this stuff was to elicit pain. Remember, every tissue creates a specific symptom. Every symptom is created by a specific tissue. So these tissues that are identified by MRI would create very specific symptoms to confirm that that is in fact the tissue in distress creating the symptom. I ask where their pain is. It's not where it should be if that structure was to create pain. That is about as big a red flag as you can get, that is not causing their pain, even though it was found on an MRI. So I'm literally a student figuring this out for the first time. So now I graduate and I come to the realization I can't follow diagnostic testing because quite obviously it's fake. It's not true. It's not correct. And imagine I graduate in 1993 and I already am coming to this realization. 1994, that study comes out that says 70% of the population who do not have lower back pain have bulging or herniated disc. By the way, the conclusion was exactly as I just described it to you. The conclusion of the study was that pain and structural abnormalities are in fact independent of one another. And the mere identification of it on a diagnostic test, a structural abnormality, should not give the concept that that is in fact the cause simply because it was identified. That was the result in 1994. I'm graduating in 1993 and realizing empirically through my evidence of treating people that symptom that they're experiencing is not coming from that structural abnormality. So I have to go on a process. And the process is that I am now going to start interpreting symptoms because the symptom is real, right? If you have palpitations, you're not confused that you have a kidney stone or you sprained your ankle. You know you're having a heart problem because that symptom is very specific to that tissue. If the entire left side of your body goes numb, you don't ignore that. You know that that specific symptom is indicative of a stroke. The brain is in distress. So I decided to go on and say, well, let me start interpreting people's symptoms. So someone had pain in their neck and they were told it was a herniated disc. Well, if it was from a herniated disc and they had the pain right here, well, you would have to press on the spine at the level of the disc and it should refer the symptoms. So I'd press on the spine and nothing would happen. But then I would press where their pain was and they'd go through the roof. And most of you who have had neck pain know if you get pressed right there, you're going to go through the roof. So what happened? Well, what I'm pressing on is a muscle called the levator scapula, and it supports the head. Well, if I press on that tissue and it elicits your pain, that is known as point tender pain, which is different than referred pain, which would have been from the spine. So it says the tissue I'm pressing on is, in fact, a tissue in distress. So by simply looking at whether the pain is point tender, referred from the spine, or referred, or point tender, where I press on the spot you have your pain, which says that's the tissue, that showed me that it couldn't be from the spine, that in fact it was a muscular deficit. So here's the next part of what makes the Yass method the Yass method. I was a very, very thin kid, had a lot of self-esteem issues. And I saw myself as a Picasso painting with two eyes on one side of my head. I was not a happy person. From 19 to 26, I tried to lift weights to try to improve my feeling about myself. I did everything Joe Weider said. I took whey protein. I did all the exercises. Nothing helped. At 26 years old, I remember that I had taken a high school physics course. And I said to myself, wait a second, weightlifting might have something to do with physics, because gravity is a force vector and you're trying to push up against that force vector. So if I improve my ability to push directly opposite to the force vector of gravity, I should be able to make my muscles stronger. And I would look at every exercise and look at hand position and how I'm stabilized or what position I should be in. And over the next 4 years, I put 40 pounds of muscle on. I go from 160 to 200 pounds. That period completes at 30 years old. What happened at 30 years old? I found this thing called physical therapy and it entered physical therapy school. So now here we are 2 years later, I'm graduating, finding the cause of pain muscular. And I had just personally developed an understanding of the laws of fixed physics pertaining to strength training. And now I can utilize this personal understanding to use to strengthen people and see how quickly I can get them out of pain. And sure enough, the first session, the second session, people are getting out of pain. This is while they're being told they have a herniated disc or stenosis or a meniscal tear at the knee causing their pain. So it becomes a problem because I'm getting them out of pain. And what they're saying to me is, oh, you fixed my meniscus? You unherniated the herniation? And so I was in a problem at that time because I was working for somebody. And if I would do that, Well, that would cause problems for the therapist who was getting all his patients from his friend who was referring, the orthopedist who was referring. So all I was able to do was simply say, well, it doesn't really matter. I got you out of pain. Just continue with the process and sustain it, and you'll be out of pain. So a few years later is when I finally opened my own office. Now I really don't have to worry about anything. Now, what made this very unique was I was in no directories. So you couldn't find me by a directory, and I had nobody referring. This all grows 100% through word of mouth. I become known as the grand diagnostician by interpreting symptoms, which by the 90s now, there's no medical person even concerned about this. Everything is, you go to the orthopedist or the neurologist, or now I'm hearing primary care physicians are referring MRIs. You just go there, you're there for 3 minutes, you say, where's your pain? You tell them where their pain is, you get the MRI, they say, come back, we'll review the interpretation when you come back. And that's it. That's how you're being diagnosed. So now there's this one guy who is interpreting symptoms and finding that in 98% of cases, he's treating the cause of pain is muscular, even with all these diagnosed structural abnormalities. And I'm doing a treatment or two, and the person's getting better. And the process just explodes. I'm eventually getting people from out of the state. I was in New York at the time. I'm getting people coming from other countries. And the awareness continues to grow. And this leads to me writing 3 books. And my 3rd book is translated into Chinese. And I've done a PBS special. And so there's been a lot of attempts to create awareness that the system as it is known is baseless. And yet what has developed is a cultural bias. So basically, if you're in pain, you're going to have family members, you're going to have friends, coworkers also all saying, get an MRI, get an MRI, get an MRI, get an MRI. Not that they have any sense that that's factually true, that it will help you, but it's the culture. The culture has accepted this. Plus, it's what insurance covers, right? Now, if that MRI shows a herniated disc, well, you're very limited in your ability, unless you come to me, the Yass method for pain-free movement, you're very limited in your ability to determine whether, in fact, that herniated disc identified is, in fact, causing your pain. So with all your family members and friends and coworkers saying, oh, go get a discectomy or go get a fusion, that's what you get. But know now that the failure rate for back surgery is 70 to 80%, and the medical system has actually created the diagnosis failed back surgery syndrome. Failed back surgery syndrome. You go there with the diagnosis of stenosis, you come out with the same, if not greater pain, you're now given the diagnosis failed back surgery syndrome, which basically means I gave you surgery, you still have pain, and the word syndrome means I don't know what the cause of your symptoms are. So now with that diagnosis, as the medical system, what they're doing is pointing out to you, they have no idea what the cause of your symptom is, but they want to continue treatment. So you'll get treatment under the guise of failed back surgery syndrome. When you go from acute pain, which is 1 day to 3 months, to 3 to 6 months, to chronic pain, which is pain sustained greater than 3 to 6 months, what happens is a mindset develops. You're no longer addressing what they assume is a structural element. What has changed in the system over the last 40 years and was reported by the National Institute of Medicine, the federal government promoting this concept, is the fact that what they're saying is chronic pain, under the guise of how the government and the medical system wants to look at it, is that that pain is no longer the result of a tissue in distress. It is no longer part of the emergency feedback system indicating that a tissue is in distress. They want you to believe, and they are promoting it this way, and this is the type of treatment you're going to get, if you go out more than 3 to 6 months, that in fact, your brain is just eliciting, shooting off pain signals arbitrarily. There's some sort of short circuiting in your brain. And in 2013, the National Institute of Medicine identified that as the cause of chronic pain, and that there's only 2 possible solutions to address it, neither of which attempts to address a cause. I need you to understand this. They're saying there is no cause. So they suggest you either get hypnosis or pain management. Hypnosis or pain management. This is even after we've had the opioid epidemic, which killed millions of people. The federal government, the National Institute of Medicine, is saying there's nothing to treat. There's nothing to treat. All we could do is try to address your symptoms because it's arbitrary, independent, has nothing to do with the tissue in distress, which is quite remarkable because they're referring to pain at the neck, the back, and the peripheral, and your peripheral joints. But if you had pain at your chest and the left arm, no, that's real pain. If you had palpitations for 3 to 6 months, no, that definitely still is real pain from the heart. We just never treated it appropriately. If you have a kidney stone and that pain runs 6 months to a year, no, that's definitely a kidney stone pain. But when you talk about neck, back, and peripheral joints, it is some sort of thing that's happening in the brain. It's shooting off, and there's nothing that can be done about it. Now, how do you think they came to that, or why do you think they came to that solution? Well, if in fact you came to the realization, which every bit of evidence, theoretical, clinical, and scientific, all prove that the MRI is baseless. If they were to acknowledge that, then what they're saying is the last 40 years have been falsely treated, and you're talking about hundreds of millions of people who have suffered unendingly. How many millions of people do you think in the world have committed suicide because they couldn't take their pain any longer? I personally have treated hundreds of people who came to me and said, I'm putting a bullet in my head tomorrow. If you don't resolve this, I cannot live like this any further. I can't get out of bed. I have no family. I have no job. There's no point in being on earth anymore if this is my life. And luckily, I've been able to resolve the pain of all of them, showing that it was muscular. Right? So they could never acknowledge that. The lost wages of people who were treated improperly, the lost families, husbands and wives, and children and parents who have never been able to function properly because pain has destroyed their lives. So you can't really acknowledge that. Now you're 40 years in. So I think what happened was they came to this one. They pulled out this one out of the hat and just said, well, the problem is, no, we treated everybody right, which is why we would have said that you should have expected your pain to be resolved in the acute stage. But your brain just decided to start shooting off signals. So there's nothing we could do about that. So it's not really our fault. Now, I want you to get a little timeline of this. So in 2007, now go back. That was 2013. I want you to see how many chances there really were that people really did know the MRI was baseless. So 2013 is when the federal government comes out and says, it has nothing to do. We have been doing everything perfect. The reason you're having chronic pain, brain just shooting off signals. No reason to think that we've mistreated anybody or that we haven't gotten the right diagnosis. 2007, the American College of Physicians, who sets the guidelines for every doctor in the United States, what they do is they see that chronic pain is an issue. 2007, it's already a rage. You're already deep into the opioid epidemic. So what they decide to do is they're going to do a 20-year literature search. They're going to go back into the annals of patient files. They're going to do a 20-year. It means they had to have looked at thousands of cases, 20 years of cases, right? 20 years of cases of people being treated for back pain. Okay. And this is their conclusion. Listen to this. They establish that of the people who sought medical care from a primary care physician for back pain, 85% of them, 85% 5% of them fell into a category called non-specific back pain. That is to say that they could not attribute their pain to any, like a knife in your back, a disc popping out of your back, 20 fractures, some grossly obvious cause of your back pain. 85%, over a 20-year literature search, 85% of people have non-specific back pain. That is the vast majority. And what they determined is when the MRI was utilized to try to establish cause and associate that pain with some structural abnormality, what was the increase in outcome? How much better did people do once the MRI was implemented to identify the cause of pain? The answer was zero. Zero. There was absolutely no improvement in outcomes by using the MRI to attach the diagnosis: herniated disc, stenosis, arthritis, pinched nerve, meniscal tear. Not one iota improvement in outcome of these people. 20 years of patients with the use of the MRI. In fact, they said that it showed that a very, very high percentage of surgeries were unnecessary, and that excessive unnecessary costs were derived through this process. And in fact, they make a recommendation that those people with non-specific back pain not use an MRI, not get an MRI. That's 2007, the American College of Physicians. American College of Physicians. God set the guidelines for every doctor. 2007 says, you got back pain, that person has back pain, and it's not specific. You don't see a knife coming out of their back or some severed limb or some wacky stuff. Don't use an MRI. Now, I said that the cause of pain in more than 98% of cases was muscular. Here, if you take the word nonspecific, why is it nonspecific? Because muscle doesn't show up on the MRI, right? So if I can't establish a structure, then I'm going to use the words nonspecific. But if you replace the words nonspecific with muscle, then here you have the American College of Physicians identifying in 85% of cases the cause of pain is muscular, and using MRIs isn't going to help you because it doesn't find that. So 85 and 98 are not that far apart. That was 2007. 2007. Okay? So somewhere in the 1980s is when the MRI starts getting implemented, the chronic pain begins. So 20 years later, there is a realization something isn't right with that MRI. Acknowledged. Now, there's multiple other studies, but just imagine the American College of Physicians in 2007 says, that's it. We think you shouldn't be using MRIs anymore. And what happens? It's 2024. They're as widely used as ever before. Nothing stopped. But I think that what happened in 2013, when you have the federal government corroborating what medical people are trying to tell you, that your pain basically is in your head and that there is no tissue, that all the surgeries we did, and you have to wrap your head around the concept. If you've had one back fusion and then you've had 5 more after it, and you're still having pain, can't you wrap your head around the idea maybe these people don't know what the cause of your pain is and they're just kind of spitting on the wall and seeing what sticks? It should be very obvious. So here's one of the biggest things I would point out to you. If all of this is making sense to you, and that's really why I'm doing this video, I need every person on this planet who's suffering with chronic pain, and I've described the magnitude of this, to know this ain't in your head, my friends. You're not making this up. And it isn't your brain shooting off stuff. You have symptoms, you have pain, altered sensation, whatever your symptoms are, because you don't have the equivalent strength output in all the muscles that are required to perform your activities. You do activities against gravity, which by definition means everything you do. Holding this cup up requires a certain amount of force. Standing up requires a certain amount of force. Walking, bending, twisting. Everything you do other than laying flat on the floor requires a certain amount of force. That is a force requirement. If the muscles trying to perform that activity do not have an equivalent force outpush, they can't push up as well. You're going to strain and you're going to elicit pain. And that will happen indefinitely until you establish the cause to be muscular and correct those muscular deficits. Okay? So, I want you to think about something beyond just pain. Oh, I have pain. I want you to think about if you have a kidney stone and it's eliciting pain, would it matter whether you're sitting, standing, bending, twisting? That pain is going to be intense and constant. So constant pain with very little variation in the intensity. If you're having palpitations of your heart, you're having an arrhythmia, it doesn't matter if you're standing, sitting, bending, twisting, that symptom is constant and will have very limited variation in intensity. So if someone says the cause of your pain is something structural, arthritis, or herniated disc, stenosis, meniscal tear, labral tear, any of these structures being identified, then for you or me to accept that as even potentially being true, you'd have to tell me that the cause that your pain is generally constant 24 hours a day with very little change in intensity because it's a structure. But you're not going to tell me that. I've been doing this for 30 years. I've treated 17,000, 18,000 people, and no one walks in my door and says, I have pain. They say, I can't bend because of pain. I can't twist because of pain. I can't go upstairs because of pain. I can't kneel because of pain. I can't reach because of pain. I can't look at my computer because of pain. You keep attaching. Think about this. It's going to make sense to you. You always attach your pain to dysfunction. Your pain comes on when you do activity. And for many of you, if the intensity gets so great, you stop the activity, you sit down or you lay down, you rest, and the intensity reduces. So there is a massive variation in intensity of your pain, and it is enhanced through activity and reduces without activity. Well, your kidney doesn't perform your exercise, doesn't perform your activity. Your liver doesn't perform your activity. Your spleen doesn't. Muscle does. So the very first question I would ask you if you get the Yass method for pain-free movement is, tell me about your pain. Is it constant, 24 hours a day, very little difference in intensity? Or would you say your pain is brought on by your activity and all you have to do is say to yourself, what's going on? When do I get my pain? I can't walk up the stairs because of pain. I can't bend. I can't twist. I can't clean the house. I can't mow. I can't work. I can't sit, right? Every time you attach your symptom to an activity, you are saying the cause of your pain is muscular. Once you do that, getting an MRI becomes basically worthless, no value, because that MRI is not going to be able to find that structural variation or that muscular cause. That MRI is not going to find that structure or that muscular cause, which is creating your inability to do your function. Stop and think about this. A muscle strain, muscle tightness, muscle imbalance, muscle weakness, none of that shows up. I'll say it again. A muscular cause will never show up on a diagnostic test. So when you establish your pain is associated with dysfunction and you get an MRI, you are guaranteeing yourself 100% you will not be finding the cause of your pain. So any treatment you get going forward based on that diagnosis from that MRI is worthless, baseless treatment. And so you could plan on having your symptoms every time you do whatever that activity is indefinitely, unless you recognize, and that's why I am here on earth, that is my purpose, is I have been given the understanding and the pathway to a method that helps you interpret the cause of your pain by interpreting the body's presentation of symptoms. And if it's bone, fine. If it's muscle, fine. If it's nerve, fine. The symptoms will present. But if it's muscular, only this method is going to identify that. No MRI will find that muscular cause. Wrap your head around that. This is the only method that will find a muscular cause. And in fact, I have told you that in more than 98% of cases, the cause of pain is muscular. Think about the population being misdiagnosed. Now think about the numbers. 130 million Americans, 1 billion people suffering with chronic pain. What's the answer? What is the answer to chronic pain? Misdiagnosis. Misdiagnosis. Now, if you're fortunate enough, you get to see this, it starts to make sense. You say you want to try the Yass method. Well, the good news is you could either get it in person in Jacksonville, Florida, or by Zoom. I've treated people in 15 different countries already, and it doesn't matter. The system is still effective in understanding whether the cause is muscular, because the magic of muscle is that beyond causing pain, it also is responsible for posture. So if there's pain from muscle, there's always going to probably be a postural deficit, and it alters movement patterns. So the way you move your arm, your leg, the way you walk, bend will all be affected. And those are the tools that allow me to know not only whether it's muscular, but which muscles. And then you get to use those exercises that I developed for myself, incorporating the laws of physics to strength training, which allows me to isolate individual muscles so that individual muscles can be strengthened to allow that strength to be integrated back into your function. So all the muscles performing your activity will have enough strength for the equivalent force requirement of that activity, and you're pain-free and fully functional. How long? Months? Years? No. If you get a Yass method session and we confirm the cause is muscular and I give you those exercises to perform, I'm telling you now, the average person sees an 80 to 100% reduction in symptom at the end of that first session. What's different about this than physical therapy? Because you're going to say, oh, I did physical therapy. Let's just be very clear about this. Go to the American Physical Therapy Association's website. They describe themselves as a palliative care, which is to say they are designed like chiropractic, massage, or acupuncture to perform a treatment to reduce your symptom. How do you know that? Another thing about physical therapy is that they will say, we can't strengthen. Everybody has to realize you've gone for physical therapy, you never get more than a pound or two. Or if you have a little pain, they stop, because their answer is that we have to resolve your symptom, remember palliative care, before we strengthen you. Well, what if the cause of the pain is muscle? You need strengthening to resolve the cause. So you're never getting that, which is why people go for physical therapy for months and years and they never get better. The Yass method recognizes that in 98% of the case, the cause of pain is muscular. So that ability that God gave me to teach me how to strengthen myself is what I utilize for the people that I treat. This is extremely accurate exercise, utilizing the appropriate resistance for that person. And that is why they see such an immediate improvement just in the first session. They are then given videos on how to perform these exercises, which also separates the Yass method. There is a transference of understanding and knowledge, which gives the person the ability to strengthen, because they're the only one who can strengthen themselves. I can't strengthen you. I could guide you, but I can't strengthen you. You have to strengthen yourself. So you end up getting these videos and performing these exercises on your own. And then there's 1 or 2 follow-ups with me to make sure you're doing it accurately. And the average person in 4 to 6 weeks is pain-free and fully functional. End of story. No more treatment, no more medications, no more MRIs or x-rays, no more follow-ups with your primary care or whoever they want you to see. It's over. You have taken control of your pain and ended it. Okay? Now, another possible question you may have regarding this thing is, oh, if I have pain with activity, how could I do exercise without pain? Well, you got that mindset from going to physical therapy, and they're giving you these kind of nonsensical, meaningless types of things to do. And so they're really not exercises as understood in the Yass method, which is to say every muscle moves one joint in one direction. Therefore, the exercise that's associated with the Yass method is having you move one joint in one direction while the rest of your body is fully stabilized. Well, if you move one joint in one direction and we use the appropriate resistance, we are controlling the force requirement for the muscle and its appropriate force output to that. So as long as you're moving one joint in one direction and I control the resistance, you can't strain that muscle. It's impossible, which means you can't get pain doing my exercises. Remember, why are you having pain with activity? Because activities require groups of muscles to perform them. If any one muscle does not have an equivalent force output for the force requirement of the activity, it's going to strain and elicit pain, and it's going to lead other muscles to compensate. If you then find those weakened muscles and isolate them in strengthening, understanding which joint and that way that joint moves for that particular muscle and applying the appropriate resistance, you can get every single muscle stronger in a very quick period of time, and that allows that strength to be integrated back into your activity. That's why in 4 to 6 weeks, you're pain-free and fully functional. That's why at the end of your first session, you will see an instant improvement in function and decrease in symptom. Everything I'm saying to you is what makes the Yass method the Yass method, completely independent. This is not chiropractic. This is not physical therapy. This is not massage therapy. This is not pain management. This is a diagnostic and treatment model. The only one that I'm aware of, diagnostic and treatment model that interprets the body's presentation of symptoms to understand what tissue's in distress. That's where you always have to start. And if you don't have that, you go. Everybody's going for treatments. It's stunning to me. And after they come to me, I say, so what were you told was the cause of your pain? And they say, well, they didn't really say. They just did the treatment. So my answer to you would be, why would you ever accept the treatment if that person hasn't shown in good faith and understanding of what tissue's in distress to prove that, in fact, that treatment will resolve the distress of that tissue, which then resolves its need to elicit pain? You just can't keep getting treatments. By now, haven't you figured out it's not working for you? Now, I want to get to one more point about this pain management nonsense. So the opioid epidemic occurred at pain management facilities. So the medical system, in their wisdom, recognized that the phrase pain management is now negative. So they started opening up these new places, and they are everywhere. They are festering like the worst infection possible. Spine and pain. Here it's Jacksonville, spine and pain. Jacksonville, spine and pain is the code word for pain management. Go there and see is someone trying to diagnose you? Is someone going to give you treatments to address the cause of your pain? Is there going to be even if they said it was a hernia, are you going to get another surgery? No. You're going to get epidural nerve blocks, cortisone shots. You might get radio frequency ablation to scare the shit out of people. Understand that means cauterizing your nerves. It's medieval, my friends. It's medieval, and it's back, and it's big, right? You can still get some opioids. Let's not get confused. What does opioids mean? Heroin. You're getting heroin, okay? So if you're going to a spine and pain facility, let's make sure you understand your pain will remain indefinitely. All they're doing is trying to mask your symptoms. Understand that. Now, let's talk about the value proposition of the Yass method. So if you want, you could stay. If your insurance covers physical therapy and pain management, and you want to keep doing that for the rest of your life and be miserable and have no life, and okay, so you're not having to pay for it, the insurance goes, okay, that's fine. That's your choice. Everyone gets a choice. But if you've come to the realization that you want to take control of your life, that you want to have your pain ended, and you want to now have your life back, then it's worth it to get the Yass method for pain-free movement, which is completely outside of that. It is a private pay situation, but the average person doesn't have to come here or see me, even if it's by Zoom, more than 3 or 4 times. And it's done. End of story. The transference of knowledge has occurred. That's what makes this different. My goal is to educate you so you have the capacity to take control of your life. That's what makes this different. There is no prisoner forever with the Yass method of pain-free movement. I was asked to learn this so I can give it to people in pain so they could have the capacity to end their pain and have their lives back. Okay? So in terms of the cost, so let's say you go for physical therapy twice a week and it's $50. That's $100. You're going to pay 4 weeks. That's $400. You went for 6 months. That's $2,400. $2,400. You come to me, it's $200 a visit. The greatest potential outlay you're going to see is $800. And what are you getting? You're getting a one-on-one session with me. It's always one-on-one. My sessions are always an hour and a half long. And at the end, I'm giving you videos to allow you to understand how to do this on your own. And I'm making sure that as we're going through this process, that we are giving you the ability to understand what to do and how to do it. So by the end, you are pain-free, fully functional, and have the capacity to do this on your own to prevent it from reoccurring. I see here we got something from Bronze Age. I have groin pain and have been told I need a hip replacement. With your method work for mostly I can function fine, but have difficulty putting on my sock. Very good. All right. So let's talk about this. This is Bronze Age. Thank you for this question. This is exactly how the system works. So here we have groin pain. Listen to this, Bronze Age. You have groin pain. Obviously, they took an X-ray or MRI, showed you a picture of your hip joint, showed you a decreased joint space, and said, oh, you see how there's a decreased joint space? You are bone on bone. And that bone on bone needs to be fixed with a hip replacement, and that bone on bone is causing your groin pain. Now, listen to how the Yass method works. If it's the hip joint causing your groin pain, where would I have to press to bring on your groin pain? The answer should be obvious, your hip joint. So I could lay you on your side. Let's say it's your left one. I'll lay you on your right side, and I'll take my hand and I'll press the head of your thigh bone into the hip socket, and I'll try to bring on your groin pain. I have done this in thousands of cases, and I could never bring it on. But now listen carefully. If I press in your groin area and I bring on your pain, that is an indication of point tender pain because I pressed on the spot and that brought on your pain. That indicates that your pain is point tender, meaning the tissue I'm pressing on is the tissue creating your symptom, right? If it's from the hip, it must be referred, and that would only be if I push on the hip and bring it on. But if I press in the groin, that means it's from a tissue there. What tissue is there? I can almost guarantee you strained your sartorius muscle. You can look it up. The sartorius runs from the outer portion of the pelvis, runs through the groin area to the down to the knee. Now, it's an external rotator. So it shortens when you put your foot up to put your sock on. If you shorten it enough when it's strained, it's going to go into spasm and it's going to elicit pain. So you have a muscular cause. I pray that what I just said to you makes complete sense on how interpreting symptoms is substantially more accurate than simply taking an MRI or an X-ray, finding some picture and saying, well, look at this picture. It must be the cause of your pain because it's not the way it used to be. And if, in fact, your problem is muscular, and that's typically because it's on one side, you're probably having one of your hip muscles. It's a hip problem, but muscular-based. One of the muscles that's responsible for keeping you balanced and your pelvis level is strained. So you probably have one hip higher than the other, and you're going to have difficulty single leg standing and squatting on one leg. This is all part of what you would see when you get a Yass method evaluation. We would have determined which muscles are involved. We'll strengthen those muscles. And I guarantee you, listen to me, I guarantee you that by the end of that session, you're going to be able to put your sock on without pain. That's what I'm telling you. Because I know it's muscular. I know which muscles. I can strengthen those muscles. In that end of that first session, I will prove to you it was muscular. And at the end of that session, I will give you videos on how to sustain this, continue to strengthen those muscles until that symptom never returns. Maybe you need 1 or 2 follow-ups. That's it with me. Hopefully, that explains to you what's going on and why this idea, this psychotic idea of taking a picture, showing you that something of a structure isn't the way it used to be and saying, since I found that, whatever your symptom is, it's coming from that is lunacy. Lunacy. Let me make one more point to you. Right now, they're doing more revisions to hip replacements and knee replacements than original replacements. Wrap your head around that. Why is that happening? Well, if the hip replacement or knee replacement originally resolved the pain, there wouldn't be any reason to worry about that. But people are still having pain 2, 3, 4 months later, the same exact pain as they had before the first joint replacement. And the only answer that the orthopedist can give you, because they got to give you something, is, oh, the socket isn't the way it should be. Oh, I didn't use the right cement. Oh, the prosthetic size was too big. And they'll just keep, and I've had people who have had 8 revisions and still in pain. I mean, I'm just trying to what would allow someone to do it 8 times and not say, I don't think this guy really understands, or this woman understands what's wrong with me. So I would certainly, and I can just put it in here, 4906-9277. If you want, you can certainly call me at that number. That's my office number. And my email address is drmitchell@mitchellyass.com. And it's livewithoutpains.com. That is my website. If you decide you did want to get a session, you could either call me and I can schedule it for you, or you could go to Live Without Pains. There's a Schedule Now button. You can schedule a session for yourself. So hopefully, Bronze Age, that helps you. For God's sakes, please don't even consider that surgery. I promise you, you have a sartorius strain, and I can fix that with 1 session and guide you to the understanding to where you can control it and prevent it from ever reoccurring. So please consider getting the Yass method. I want you to understand, people understand the ramifications of what people's lives, how they've been destroyed. So I treated a guy who for 30 years, he had pain at his front thigh, side thigh, and groin. Oh, his front thigh, side thigh, and butt. 30 years, he was told it was from his back. He had 7 surgeries, 7 back surgeries. At the end of the 7 back surgeries, he was already addicted to opioids and basically was told he has to get off that or he's going to have to be divorced. So he no longer has the capacity to use opioids. So this guy's now living without any way of altering his pain. And he is just crippled. The word of mouth, he finds out about me. He lives in New Jersey. I'm in Florida. And so we do a Zoom session. So his wife is there, and I say to her, I want you to push into his spine as hard as you can. Remember what I'm trying to tell you about understanding symptoms. They're telling him that pain at the front thigh, side thigh, and butt are coming from his spine. That's why they're doing these surgeries. So I want her to press on his spine and see if she can bring the symptom on, because that would confirm what they're saying is true. Well, she can't. She couldn't do it. So then I said, go press on his front thigh, and he goes through the roof. I mean, crippled pain. That's the level of pain he gets. So I said to them, in less than 3 minutes, I just showed you those 30 years of 7 surgeries were never going to fix your problem, because your problem wasn't referred from your back. It's point tender, showing that you strained muscle in your thigh. So I gave him a series of exercises, and he was limping when we first started the first session. By the end of the first session, he's no longer limping. I do 2 or 3 more sessions with him, and now he's really feeling good. Now he's starting to walk. I don't hear from him for a few weeks. And I'm like, oh, boy, I hope nothing happened to him. I don't know why he didn't follow up. And he simply tells me, I've been doing the exercises, and now I'm walking 5 days a week. This guy couldn't walk from one room to another. And now he's walking 4 to 5 days a week. So I recently just heard from him, 2 years now. This guy's playing tennis 4 days a week. And if he's not playing tennis, he's either walking or he's on some sort of bicycle, recumbent bicycle. He will tell you that the Yass method changed his life. 30 years of torture from the medical system. And he always jokes about this. All I did was give him 4 exercises. All I did was give him 4 exercises. But those 4 exercises were the exercises he needed to strengthen the appropriate muscles so that he could weight bear without straining them and eliciting his symptoms. And he's never stopped, even through these 2 years. And now, actually, he's gotten so aggressive with tennis that he strained his hamstring, which is why he contacted me again. And we just added another exercise, and that's going to take that away. that guy will tell you his life was changed forever by simply acknowledging through my presentation that he was misdiagnosed by the use of the MRI for 30 years and that the interpretation of his symptoms gave him the understanding that his problem was muscular and it resolved his pain and he has had his life back fully. He's 60-something years old. He says he feels like he's 20 or 30 now. Okay? That is misdiagnosis through the existing system. Interpretation of symptoms gives you the right answer, gives you the ability to resolve the pain and sustain it so you have optimal function and optimal quality of life, which is why you're on earth. Let me give you another one. Guy has horrible altered sensation from his shoulder blade, and many of you might have this, from the shoulder blade down his arm to his ring finger and pinky. What do you think the medical system thinks that's from? Cervical spine. Get an MRI, find a herniated disc, pinching on a nerve, they tell him, that's causing his pain. They tell him he needs surgery. So he decides, well, if that's what's necessary, okay, but I'm going to start searching around. So he somehow finds some video of me. He lives in Mississippi. I live in, I think it's Mississippi, and I'm in Jacksonville, and he calls me, and this is what I show him. He says that they told him it's from his neck and he needs surgery. I said, well, let's examine that. So I said, so they're saying it's a structural abnormality of your cervical spine. So I'm sure you're having massive pain at your neck, right? He says, I don't have any pain at my neck. My pain begins around my shoulder blade, then goes down my arm. So I said, okay, but you obviously have a massive loss of range of motion. You can't move your neck, right? And he said, I don't have any loss of range of motion. My neck is fine. I have no. So I said, let's just try to wrap your head around what they're saying. They're saying you have a structural abnormality in your cervical spine that is so bad, enough to cause a symptom to run down your arm, but you have no pain in your neck and no loss of range of motion. Does that make sense to anybody? Does anybody who ever hears this think that makes sense? Clearly, that's not true. That herniated disc is independent. It's been there for 20 years. It's probably been there way before he ever had that symptom. It has nothing to do with the symptom. Treating it would never fix his symptom. So what I did, and I will show you this, all I did was I said, I'm going to show you a picture. Serratus anterior trigger point chart. So what this is, most people think that only nerves create reverse symptoms. Muscles can reverse symptoms as well. How do you know muscles can reverse symptoms? What is the indication of a heart attack? Pain where? At the chest and the left arm. Is there anything wrong with your left arm? No. Where is that symptom being referred from? Your heart. What's your heart? It's a muscle. So what I said to him was, I want to show you a trigger point chart. And I showed him this. Now look very carefully. This is the serratus anterior muscle. It wraps from the shoulder blade around it attaches to 8 ribs. And if you look right here, look at that symptom. It runs around the shoulder blade, which is down here, and back here, and then runs down the arm to the to the ring finger and pinky. You see it? So certainly that sounded more like what was causing his symptoms because it described the exact location of his symptoms. So in looking at him, I could see he had forward shoulder posture. Remember, I told you muscles are responsible for posture. So weakness or imbalance causes improper posture. So he had improper posture. And when he raised his arm, his shoulder blade would rise, which should not happen. So that's a change in movement pattern. So I was able to establish that the muscles that supported his shoulder blade were not strong, and it was causing this muscle to shorten to refer a symptom. To understand how bad this was, this guy did work on his computer, and he would have the computer. So anytime he had his arm in front of him, it would incite this symptom so bad he'd have to go lay down on a recliner. This guy could not work. This was affecting his ability to make a living. So I showed him a series of exercises. And I don't think I did more than 3 sessions with him. And I would say where I did follow up and he did the exercises. And I believe we actually got to the point where he went from doing it with resistance bands to using weights in a gym. And within 6 weeks, the symptom was fully resolved. Not just fully resolved. He could sit at his desk in his computer for hours on end without ever having a symptom. This is a guy who had his life given back to him. What would have happened if he followed the concept of the medical system, taking an MRI, finding a herniated disc? And he talks about this. There's a video. I think it's on my Facebook page. Scott Reed is his name. You'll see. He'll tell you that if he had done that, he would have been in worse trouble because he would have not had post-surgical symptoms established with his neck and still never addressed the muscular causes of his symptoms. The muscular causes of those symptoms, right? Which was shoulder blade musculature. All right, let me tell you about this one. So all of these are and any one of these people will corroborate this. I see a guy the day before he's scheduled for bilateral knee surgery. Bilateral knee surgery. His pain is around his kneecaps, and he is told by the orthopedist that the problem is that his kneecap isn't tracking through the groove that it's supposed to properly. It's tracking out to the outside, and it's rubbing. So what they're going to do is some kind of manipulation of the connective tissue that holds the kneecap. They're going to somehow try to shift it over. That is going to happen the day after he is scheduled to see me. And it was through word of mouth that he found me, which was a last resort. So I evaluate him, and what I find is that the reason that his kneecaps are causing pain isn't because it's tracking to the side improperly. It's because it's too compressed in the knee joint. It's too compressed in the knee joint because this guy had developed such a ridiculous imbalance between his front thigh muscle, his quads, and the back thigh muscle, his hamstrings, that the quads had shortened. And if anyone wants to look at the way your kneecap works, when you have your knee straight, it points straight up. When you bend your knee, it's pointing this way. So the kneecap actually travels in that joint. It's called a modified pivot joint. It's the only joint where the pivot point moves. So the quadricep has to have a certain level of flexibility for that to happen. If it doesn't allow that to happen, instead of coming down, it's just going to get jammed in and it's going to become excessively compressed. So all I did was massage out his quad and hip flexors, stretch the hamstring, stretch the hip flexors and quads. And before you knew it, in a half hour, 45 minutes, this guy was able to take his butt and put it right down on his heels without pain at his knees. So I showed him a series of exercises to strengthen his hamstring and glute max, resolve the imbalance. He canceled the surgery. It has been over 2 years. He has never gotten that surgery, nor has he ever had that knee pain come back. What do you think would have happened if he got that surgery? More disaster. Post-surgical symptoms. And if you went for physical therapy, they don't even know what the hell I'm talking about, muscle balance or anything. They would have strengthened his quads or attempted to give him something to strengthen his quads in some bizarre fashion, which would have fed into his problem. He'd have been worse off after physical therapy, which is how most people stop physical therapy because they get no benefit from it. They get no benefit from it because it's not directed. It's not purposeful. Okay? This is interesting. I want to tell you about this lady because when people talk about their surgeries are success, this is the only reason a surgery of a structure which was not causing her pain will ever be perceived as successful. So this lady has pain. What she is told is in her lower back. And she gets MRIs and she has like 3 herniated discs or something. And so they've given her some epidural nerve block and it worked a little bit, but eventually doesn't work. And now they're telling her the only thing she could do is get surgery. And she doesn't want surgery. So she comes to the realization, and by the way, if you get surgery, the surgery isn't what fixes you. It's because you're also told, anyone who's gotten back surgery, know that you're told not to twist, bend, reach, lift anything more than 2 pounds. And basically, you're stopping life. What does stopping life mean? It means you're reducing the force requirements of your activities. So there's two ways if you have a muscular deficit of resolving the pain, the cause of pain. Either you increase the force outputs of your muscles, strengthen them until their force output is greater than the force requirement of your activities, or what most people end up doing because they don't know their problem is muscular. And after all the surgeries and the epidural nerve blocks and the opioids, they haven't been able to resolve their pain. They come to the very, very, very sad realization that if they simply stop life, stop doing everything, stop walking, bending, twisting, stop lifting anything. Basically, you're not allowed to go down to the floor because you can't get up from the floor. You basically stop life. If you stop life, you can now probably not have that pain come on. But this is the downside, and this is where this lady was. The anxiety about whether it came back far, far, far outweighed the level of pain she was experiencing. She came in her first day, she had a breakdown right in front of me. She was so exhausted, mentally exhausted about living every day, wondering if that pain was going to come on because she made that one tiny little move that was going to bring it back on. Now, let's go and look at the situation she found herself. She was told that her pain was from a lumbar herniated disc because an MRI found it. And since it was found at the time of that, that was the cause of her pain. Let me show you something. Piriformis muscle. So, if you look here, I said, what did I tell you I did when I first started this? I said, can you point to your pain? I need to know where your pain is to understand what's causing it. And she pointed right here. And if you notice, it says piriformis muscle. Now, that's your lumbar spine. This point here is called the pelvic rim. And if you take your hands and put it here along the pelvic rim, it basically delineates the bottom of the lumbar region. The top of the lumbar region is the rib cage. The bottom of the lumbar region is the pelvic rim. Below it is the gluteal region, and that's innervated by the sacral spine, which is this bone here. 5 fused bones and nerve roots come out of there. So this area where she described her pain could never have been innervated by an herniated disc or a pinched nerve or stenosis in the lumbar region. It is literally physically impossible. What they told her was the cause of her pain could never be the cause of her pain. It was literally impossible. And yet for a year and a half, she's been treated based on that. You understand the lunacy of where we are with this? So she came here. I knew it was her piriformis. I knew it was due to hip dysfunction, meaning weakness of a muscle that stabilized the hip region. And we did exercise, and within that first session, the pain was gone. And I told her, now that you know what the cause of your pain is, for God's sakes, try to live your life again. And she's been back one more time, and she told me she has no more anxiety. She's living more fully. She has not had a symptom come back, and she's doing her exercises. And within a couple of weeks, this is over. She'll be pain-free, fully functional. She'll never have to worry about this pain again. She'll never have to worry about medication. She will live fully with the zest of life, which is what you should be doing if you're on earth. That's the kind of thing that the Yass method can do for you. That's the difference between interpreting symptoms and simply blindly accepting what an MRI told you is the cause of your pain. So I have been talking for a little more than an hour. I think this is critical. I want to try to do this more consistently. I'll let anybody come on. You could ask a question, or you can contact me by phone or email or go on my website. I don't care how. But if you're suffering with chronic pain, at some point, you're going to have to come to the realization the reason you're in chronic pain is because they've been treating the wrong tissue. End of story. That is the only rationale for why you're in chronic pain. The tissue in distress remains in distress. So please reach out. That is your opportunity. I have an office in Jacksonville, Florida, which allows you to get in-person sessions there. If you're anywhere else and you can't make it here, I've treated people in 15 different countries. Do a Zoom session. The Zoom sessions are videotaped. We make sure you get that video. That's how you know you're doing everything correctly after the session. And we will make sure that within 4 to 6 weeks, you are pain-free and fully functional. and your exposure is minimal and it's not going to go on forever, the whole purpose of this method is transference of knowledge. The goal is to get you to be able to do what you need to do so that you could have control of your life and live the life you justly deserve. Okay? So that's going to be it for now. I'll come back on in maybe a few weeks and we'll do another session. All right? For now, that's Dr. Michel Yass, wishing you a pain-free, fully functional life. Bye-bye for now.